When does someone need to start worrying?
The issue is, do you have an incipient problem or do you have a problem that needs treatment, right? And these are two different issues. If you can control it, you better be careful and you better control it, because you're going to lose control. And if you lose control, do you need treatment? If you can't stop on your own, you're going to need some help. Do you need inpatient treatment? Well, inpatient treatment these days is generally reserved for people that are going to have withdrawal. And let's remember, alcohol is the only drug that people commonly use that's a carcinogen, that's toxic to pretty every tissue in our body, and from which the withdrawal is not infrequently fatal. True DTs is a fatal process. So it needs to be managed in a medical setting. So always talk to your doctor, help get an assessment. If you think you're drinking to the point where you could have withdrawal, if you feel shaky in the morning, if you're having a sort of kicker in the morning to ameliorate the withdrawal.
And quickly for people watching, delirium tremens, oftentimes those symptoms don't come on until 48, 72 hours after your last drink. And that is a medical emergency. So that's why this is important for people to listen to.
And by the same token, alcohol withdrawal seizures separate from DTs can be all the way up to 2 weeks later. And you could be driving and have a withdrawal seizure. So this is all need for medical management. It's not a trivial issue. We think about alcohol because we all have relationships with alcohol.
And it's legal. So
it's legal. It's been
must be okay.
It's been in our culture throughout human history. It's a problem. Don't make no mistake about it. It's a very serious drug.